You may remember Hannah Dietrich and the amazing reconstructive surgery Dr. Khiabani did to save her hand. Here's Hannah today. Michael and Heidi Dietrich brought their 4-year-old daughter Hannah to UMC's Trauma Center after she sustained a traumatic injury to her right hand.
Missing bone from the top of her hands. These two knuckles were missing bone. This bone was shattered. Her thumb and her pinky were still intact at that point, and then all the tissue in this area, besides her palm, was completely missing.
Local reconstructive surgeon Kayvan Khiabani was on duty and performed the initial surgery to save Hannah's hand and ensure it was free from infection. Then he outlined his treatment plan for saving Hannah's hand. He also encouraged her parents to get a second and even third opinion.
I called everybody that I could call in Mayo Clinic in Arizona and was actually turned down by 2 hand surgeons at the Mayo Clinic. They did not want to take someone so young, take on a case that was so, such a hard case, because they couldn't come up here and see it, and they didn't want me to bring her all the way down there without seeing it, and also because of her age. They just don't take patients under the age of 16 very often down there. So I called UCLA, which was the next best place, and talked to a couple of people out there and ended up being referred to Dr. Jones, Neil Jones, and who's supposed to be, the best hand surgeon out there, and he said, "I'm leaving the country and you need to call Dr. Khiabani." And I said, "Well, that's her doctor." And he said, "Well, I trained him, so, he's the best guy out there, and he's got amazing..."
Dr. Khiabani's plan complicated one, using bone from Hannah's hips to reconstruct the bones in her hand, then using tissue from her forearm to form the back of her hand.
Hannah's angel, her superstar, was here in Vegas, and I did enough research, and I have some doctor friends here in the city as well that did some research on Dr. Khiabani, and everybody was very, very excited about it.
And what does Dr. Khiabani say to that?
Not a superhero, I'm just a doctor, I'm just doing my job.
A job well done by the reaction of both Dr. Khiabani and Hannah as they meet for a checkup.
Show them how strong you are.
Oh, what are you doing to me? Look at that.
It's exciting. It's exciting to see her play baseball and, grip a bat and hit the ball and right-handed, no less, and, excel in karate, breaking boards and all kinds of fun stuff, and playing the piano was the kicker for me, because that was one thing that I always wanted her to do. And when this accident happened, I was pretty bummed. I mean, that was one thing that I said, she'll never be able to play piano, I focused, for a couple days on all the things that she wouldn't be able to do instead of all the things that she would be able to do, and she's completely proven all of us wrong.
So what we were talking about the same night of the operation was this elaborative plan for this mega surgery, which every individual part of it had to fall into place like a puzzle for it to all work. Both the tissues that we used and also the experiences that we've had to come into place and gel it as one cohesive experience. And I'm glad to report that seems to have happened.
Hannah will need future surgery to accommodate her growing body, but for now, Hannah is enjoying the use of her new right hand.
We're now about 6 months after the operation, and Hannah is moving all of her fingers independently and individually. She's making a fist, she's grabbing and holding different objects, and from what I hear, she's playing piano on the television, so I think she's happy, and I'm ecstatic.